Hi, I'm Dr. Quintero here at HQ Dontics, Brickell and Key Biscayne, and today we're going to be talking about dental implants. Dental implants are a type of prosthesis that are meant to replace the root of your teeth. Once somebody has lost a tooth, we put a dental implant. It's usually inside the bone. That bone will integrate to the dental implant, and then the implant is going to become solidified within the bone. Then we can use it to restore a tooth. Every time a patient loses a tooth, our ideal option to replace that missing tooth will be a dental implant. Dental implants have many advantages. The biggest advantage of a dental implant is that if you have a missing tooth, one missing tooth, you're going to replace it with one implant. In the past, we only had bridges to do that. Bridges, like I said in our other video, bridges need to have teeth prepared around the space. So that means that there's going to be a tooth structure loss. With dental implants, you can avoid that tooth structure loss. When the decision is made to go with dental implants, the process is usually very simple. The first thing to see is the medical history. We want to make sure that you're healthy. There are only two contraindications for dental implants. It is not age. The first contraindication for dental implants is uncontrolled diabetes. If you're a diabetic and you're not under control, that's the first thing that we need to do. The second contraindication for dental implant is smoking. So if you're a smoker, the chances for dental implant failure are a lot higher. Okay, so the steps in placing a dental implant are a few, but they're rather simple. The first thing to see is if we have enough bone available. Remember that the implant is going to be placed into the bone, and so we need to have enough volume and enough density of bone. The way to know that is by taking a CT scan or a three-dimensional radiograph. The next step in doing that is planning your dental implant. Once we have seen that you have enough bone, then we are going to proceed to plan your dental implant. This is done computerized, and it's basically all digital. We are going to propose the position of that implant, and then we're going to create a surgical guide, which is then used to place that dental implant in the exact position that we have planned. That is very important. Once the dental implant is in place, we are going to either close it completely or we're going to leave a small screw that is going to be visible for a little bit until that implant integrates, which takes about 2 to 3 months to happen. Once that has happened and the implant has integrated into the bone, then we're going to take an impression of that dental implant that, remember, is replacing the root of your tooth. And with that impression, we're going to create the crown, which is going to be the restorative portion of that dental implant. That is going to be sent to a lab, and then usually we can cement that crown or we can screw down that crown to that dental implant. Very simple. Bone grafting is required every time we don't have volume of bone available to place the dental implant. We want that implant to be surrounded 100% and completely by bone. So if you have had a tooth that was lost a long time ago, the chances that your bone has reduced in size and volume are very big. And if that happens, we can restore that bone that you're missing by doing a small bone graft. Bone graft, of course, can be small, like I just said, but it can also be extensive. And the procedures to do that can vary a lot, but it is done and it can be done. Depending on the extent of dental implants and how many we are placing, the recovery is going to be different, but it's usually no more than 1 or 2 days. Dental implants can last a very long time. In the past, we would say a dental implant could last up to 20 years. With the newer technologies, we really don't know how long dental implants can last, as long as they stay integrated and you keep coming to your dental visits and you keep that area clean. Dental implants, once they're integrated in the bone, they can last for a lifetime. Dental implants cannot get cavities. That is a huge advantage. But dental implants can get infected by bacteria around them, and that is called peri-implantitis. Peri-implantitis, it's an inflammation of the tissue around the implant that is going to end up having bone loss, and you can lose that implant by peri-implantitis, just like you can lose a tooth. So keeping the area clean, still very important. Some insurances cover dental implants, very few ones. Dental implants are considered a luxury, and they are, but they are the best option out there to replace missing teeth. I would not recommend waiting on dental insurances to do this kind of procedures. It's all for your well-being in the end. Here at HQ Dontics, we have many different financial options, and we help our patients to get the treatment that they need regardless of that need for financing. We are going to do our best in giving you all the information needed so you can make your best choice. I hope I answered all your questions about dental implants today. If you have any other questions, just please feel free to give me a call or send me an email. You can call us anytime at 305 373 9699. We're happy to help you here in Brickell or in Key Biscayne.